Hello everyone, welcome back to Rep Set Fit, a health and fitness channel dedicated to women in the beginner and intermediate stages of a lifestyle change. My name is Tiffany, the founder of Rep Set Fit, and I am a health coach and weight loss body transformation specialist. In this video, I'm going to give you a list of things, 6 specifically, that you need to do to begin moving your body and starting your body transformation. FYI, I'm not a medical doctor. However, I do understand and I know that the following points are going to accelerate your path to a healthier life and your weight loss goals. To get your baselines, I suggest that you go to the doctor's office because that's going to be the most accurate testing. However, if your appointment is a few weeks or months away, you can always go for the alternative, which is hitting up a drugstore like CVS or Walgreens or even a Walmart or Target and grocery stores to find a self-serve kiosk. I happen to go to Walmart and I found this self-serve testing area. This is my first time doing it. I thought it went very well. It was a lot of fun, and I'm just going to show you a few things I learned. First up, we have blood pressure. So what I can say is your blood pressure is an indicator of the conditions about your heart and blood circulation in your body. So 120/80 is considered good or normal blood pressure. However, once your numbers start to rise and you hit 140/90, you're considered hypertensive and definitely need to speak with a doctor before beginning exercise. High blood pressure is also more prevalent in African American individuals. An alternative to going to the doctor's office to get your blood pressure is using a blood pressure machine, which is what I found and used at Walmart. I thought it was fairly accurate, and at the very least, you'll know if you're in the normal or high category. Okay, next up we have type 2 diabetes. So we know that type 2 diabetes is often a result of poor nutrition and exercise habits. And when it's paired with sedentary behavior, it can become crippling. So you're going to want to get your blood drawn to measure glucose levels to determine if you're pre-diabetic or possibly diabetic. Now, most people don't test their own blood sugar unless they have been diagnosed with type 2 diabetes already. So the best way to find out if you're not a known diabetic is to go to your doctor. Next up, we have cholesterol. Cholesterol is a fat-like substance found in the blood and body tissues and in certain foods. When you go to the doctor's office, you'll get or ask for a lipid panel or a lipid profile to test your cholesterol. High cholesterol is often a risk factor for coronary artery disease and or a heart attack. Unfortunately, getting your cholesterol tested can only be done through blood draw, so going to the doctor's office is a great idea. Let's talk body mass index, or BMI for short. It's the relationship between height and weight to determine your weight category, like underweight, normal weight, overweight, and obese. If you believe you're overweight or your doctor has suggested losing weight to improve your health, calculating your BMI is recommended. To calculate your BMI, simply divide your height by your weight. Or another easier way is to use a chart. Simply find where your height and weight intersect and use that number to put yourself in a category. Numbers between 25 and 30 are going to put you in an overweight category, and anything over 30 is obese. While it might be discouraging, write down this number and create a short-term goal to decrease your BMI if you're overweight or obese. On to resting heart rate. The best time to measure your resting heart rate is first thing in the morning before you begin any activity. Your resting heart rate is important to know how hard your heart is working at rest. This baseline can help you understand what your target heart rate should be when you begin exercising. As I discussed in the Rep Set Fit intro video, you don't want to engage in vigorous intensity workouts too soon. This could increase your chances of stopping an exercise plan, or more importantly, increase the risks of a medical emergency. The average resting heart rate in women is approximately 70 to 80 beats per minute. An alternative to getting your resting heart rate without going to the doctor is to take your pulse yourself. While sitting down, place 2 fingers inside your wrist or on the side of your neck for 60 seconds and count the number of beats. Another alternative is to use an activity tracker like a Fitbit, Apple Watch, or Garmin. All right, and finally, your family history. So your family history of heart disease is very important to know, particularly if your father has a history of heart disease or heart attack or even diabetes before the age of 45 years old. And the same with your mother before the age of 55 years old. And if neither parent or either parent or both have a history of heart disease, your risk definitely increases. So getting this information may or may not be simple, but it's also just a great conversation to have with your parents to understand maybe how they could have changed their lifestyle sooner to prevent the disease. Okay. The 6 points that were mentioned before have more to do with your health than your weight. And that's because your health doesn't determine your size and vice versa. So I believe being healthier should always come first, and your weight loss goals will be more easily achievable. Don't wait for a health scare before getting your medical information. Be proactive, not reactive. If you made it this far in the video, I'm gonna assume 2 things. 1, you don't want to be a negative statistic, and 2, you're ready to change. And that makes me very proud. All right, it's about that time. Go book your doctor's appointment. All right, everybody. Again, if you think this video is going to help you get closer to achieving your health and fitness goals, subscribe. If you like any of the information I provided, please hit that like button. And if you know someone who will benefit from this channel and all the valuable info it has to offer, please share it. Leave a comment below, questions, any feedback that's going to be useful to making this channel the best channel for you to reach your goals. I'll see you guys next week, and we're going to start moving.